Morning, ladies and gentlemen. Today we're going to talk about altitude otitis for health section. Otitis is an ear inflammation which may cause mild to severe pain. It's a relatively common issue which interests both adults and kids and consists in barotraumatic event mainly caused by missing balance in between the middle ear and the external environment. The good news is that usually it is not dangerous and can easily be prevented through a few simple means which are usually unknown to travelers though. However, we tend to underestimate that about 10% of adults and 22% of children might get constant and consistent damages to the tympanum after a flight, even though they usually heal spontaneously. So let's try to understand what really causes the otitis. The middle ear cavity is an area located in between the tympanum, which closes the external hearing duct, and the inner ear, which contains the cochlea and the vestibular system. In the middle ear, there are three little bones which go under the name of malleus, incus, and stapes, which transfer the tympan's vibrations to the inner ear's fluid under form of an acoustic wave. Middle ear's cavity has its own inner pressure, which is normally equal to the atmospheric one. Now, pressure in the eardrum is kept by the Eustachian tube, defined as the connecting channel in between the middle ear and the nasal cavity, where the pressure is the same as the atmospheric one. When we have a significant external pressure variation and the Eustachian tubes are not able to balance it out, we usually can observe the onset of classical symptoms caused by the high tension in the tympanum. Notably, if we are on a flight, this variation is due to the sudden altitude change, both going up and down, even though the plane interior is pressurized. In addition, if we have a previous condition of ear or airways congestion, the Eustachian tubes, which are responsible for pressure adaptations between the external environment and the middle ear, do not get completely open and balance the pressure variation in an adequate way. This is how the inflammation process gets started when we no longer have balance at this point. What does happen in case of inflammation? Well, in case of inflammation, both the tympanum and the Eustachian tubes are covered by the pharyngeal mucosa, which get inflamed and congested. Now, the inflammation generates the tube clog, thus causing an air and mucus stagnation in the middle ear cavity, leading to a barotraumatic issue. In addition, if we already have an allergy and infection or anatomical defects, the situation can even get worse. How does it show? Well, the most typical symptoms in the sensation of clogged ears with a semi-constant buzz due to the tympanal contractions. Now, if the pressure change is particularly consistent and quick, we could also have dizziness and ear pain. In very rare cases, the barotraumatic otitis can cause a tympanum perforation together with acute pain and hear loss, with or without tympanal hemorrhage, showing on the outside through a bluish color. Now, if your symptoms are particularly intense and persistent, go see your ear specialist as soon as possible. How do we treat the otitis? Most of barotraumatic issues only require simple symptomatic treatment, which is over-the-counter molecules, pills that can easily and quickly solve the issue itself. Now, the most effective approach would be to associate an analgesic drug, such as paracetamol, to an anti-inflammatory molecule, such as ketoprofen or ibuprofen. These drugs are commonly auto-medication, so it's always better to choose low dosages so we can safely administer them several times a day when needed, just when needed. An alternative treatment is represented, on the other hand, by autologic drops such as Autogan for a local anti-inflammatory action. Now, is there any way to prevent the barotraumatic otitis? Definitely yes. When we are taking off, but most importantly, when we are landing, we should perform some simple compensatory exercises in order to balance out the pressure variation between the inner and the outer tympanal membrane. The most effective operation to this purpose is known as Valsalva maneuver, and utilized also by scuba divers during the descent. We plug our nose, flattening the nostrils between the thumb and the index finger, and then keeping the mouth closed and pushing the air towards the back of the throat like this. This maneuver opens the eustachian tubes and allows the compensation. The alternative method, however less effective, is to chew a chewing gum or sucking on a candy or even stimulating a series of yawns. Now, these latter techniques are particularly effective for kids as they're easy to realize. For babies, the best solution would be the use of a pacifier for the whole duration of takeoff and landing. And last but not least, we should use a nasal decongestant, spray or drops, in order to free the upper airways, such as Sudafed. I hope this video was helpful for you guys. If you have any questions, you can email me at raf.pilla@gmail.com. Again, raf.pilla@gmail.com. And thank you for watching.